In our communities, in our Indigenous communities, there's such a high rate of not only kidney disease but also diabetes, and so to me that's what motivates me to do this work, is that we can become involved in the research, which I think is really important.
If we're working in kidney disease and we're not accessing Indigenous communities and Indigenous healthcare providers, then the whole, what is the value of your study? Because we as Indigenous people, everyone knows that kidney disease has a strong impact in our community, and you need to understand those reasons of why it's affecting our community, but you need to be making sure that you're reaching out. And so I've been able to ask researchers those tough questions, and then been able to help the researchers to make contact and to start that process.
So for me, I've been able to help bring some of those things that I've experienced and I've learned, and I can bring those to the network and help people to understand things from an Indigenous perspective and bring that perspective.
I've really come to understand the effect of colonialism and all of those events, and it absolutely it stops me. At points it absolutely stops me, because I look and I think I had access to care. I was screened. All of those things were done. My disease was caught early, and I was able to receive treatment, an aggressive form of treatment. I was very sick, but I was able to be well, and that doesn't work for most of the Indigenous people that live in Manitoba.
I really feel that researchers and the nephrologists and other healthcare workers, they really need our voice, because we are patient partners, and I think the key word in there is partners, and I think that really elevates our voice, because it's no longer, it's just the researcher or the nephrologist or doctors making decisions on their own, but now involving patients as partners, I think is really key.
As an Indigenous person, bringing relationship building to the process and asking researchers, so what are you doing to make sure that your research participants are going to be of Indigenous descent? What are you doing? What is your plan?
For me, I think it's really about understanding who we are as Indigenous peoples, and helping people to understand those histories, those contemporary lifestyles, our languages, so that they can make informed decisions.